Hi, everyone, and welcome to episode 117 of the Veterinary Behaviour Chat podcast. So, today I'm going to do an episode on melatonin, and I have to be completely honest that as I was kind of researching this topic in depth, it's actually left me with a lot more questions than answers. And the reason I've actually decided to do an episode on melatonin was because I received a viewer question about the use of melatonin, whether melatonin could be helpful in a certain situation. So this is in a shelter setting. And the question was, could melatonin be given to help settle the dogs at night, to help them in the shelter setting? We know that not being able to sleep and excess noise and not being able to get enough rest is a really common occurrence in shelter situations. And so the question was around, would melatonin potentially be a good option here? Now, I'm going to be completely honest and say that I have used melatonin, but not very often. And also when I was studying for my board exams, it wasn't necessarily something that I did a deep dive on, because the general consensus is that we just simply don't have enough evidence, we don't have enough information, we don't have enough research around melatonin, specifically for the use in behavioral medicine. So, to treat anxieties and perhaps to, treat other behavioral disorders. So when I kind of did my deep dive, I found that there are a number of other areas that melatonin has been shown to be useful potentially, and I'll kind of touch on those lightly. And then one of the big areas that has been looked at, where Professor Gary Landsberg in particular has done quite a lot of research, is been around helping senior pets manage their sleep-wake cycles and potentially anxieties that might result from that. So, and the other big area that I was very much aware of was the use of melatonin within the so-called chill protocol, which I'll dive a little bit deeper on as well in a second. So the chill protocol essentially is a protocol to use before veterinary visits. The study was published in JAVMA in 2023 by Costa et al. So coming from an anesthesia analgesia sort of background, I think looking at how can we make veterinary visits easier. And interestingly, there is a little bit of human literature around the use of melatonin in the sort of pre-operative period. And there is some research around being able to reduce the quantity of propofol and midazolam, so potentially general anesthesia agents after the pet had melatonin prior. So there are like a number of different areas that has looked at the use of melatonin. But I guess for us on this podcast, sort of looking at behavior medicine, I think, can we use melatonin to reduce anxiety? Can we use melatonin as a way of regulating sleep-wake cycles? Is it something that's useful for our senior pets, perhaps with cognitive dysfunction problems? Is a really interesting one. And I'm going to kind of dive into what we know. But like I say, this is probably not a completely comprehensive set of information. I'm sure there is lots more information out there. I'm just going to sort of highlight what I have found, what I know, and where I think melatonin might have practical applications and where not. But I think we need to preface everything with the fact that we just haven't got a lot of evidence. So some of this information potentially is somewhat anecdotal. And even when I did find papers sort of saying that it might be useful in the reduction of stress, there was no real sort of further, deeper research to back that up. So I think, and that's what I usually say, and I think that is the general consensus in the behavior world, is that we just don't have enough information. And anecdotally, from an experiential point of view, do we veterinary behaviorists see melatonin to be useful? Probably not that much, which is why, there isn't a huge sort of push towards using a lot of melatonin in our behavior cases. All right, let's get started with what even is melatonin. So melatonin is a neurohormone. And interestingly, so from a molecular structure point of view, it does sit within the group of the amines. So the monoamines are serotonin, dopamine, noradrenaline. And melatonin is actually a derivative of serotonin and is synthesized from tryptophan. So it does kind of sit within that class of the amines. It's actually what we call an indoleamine. So not quite like a monoamine like serotonin, noradrenaline, and dopamine, but in a similar sort of what within the class of the amines, it's an indoleamine. And yeah, from a synthesis point of view, it's quite closely related to serotonin. Now, most of us, when we hear the word melatonin, will immediately think about sleep-wake cycle, jet lag, all those sorts of things. And that's exactly what melatonin is most known for. So melatonin is produced by the pineal gland, which is a tiny but really important gland that sits really deep within the brain and produces melatonin. So melatonin is excreted maximally. So the most melatonin is excreted during the night. And it acts as a signal of darkness. So it provides information to the brain and other organs to say, night is here, darkness is here. It's time to get into or to do whatever is necessary to sort of induce rest and sleep. So I think that's what we mostly know melatonin for. However, it's really important to know that melatonin acts on other endogenous systems as well. So, for example, temperature, mood, the immune system, other hormones, and other metabolic pathways. So it's not just involved in the sleep-wake cycle. It's potentially involved in lots and lots of other metabolic processes, lots of other hormonal processes, and lots of other sort of systems, as I've just mentioned, that temperature, mood, immune system sort of system. So it is a really important neurohormone, and I think it's really, really important for sleep-wake cycles and for the health even that brings. We all know, and I did a great podcast episode with Dr. Carrie Tooley on the importance of sleep. So we know that in pets that struggle with sleep, where sleep-wake cycles maybe aren't optimal, where that's interrupted, that can then in itself have a knock-on effect on emotional arousal, as Carrie mentions in the podcast, and mental and emotional health. So I think that's one really, really important point. And then the other thing I learned about melatonin is that melatonin is an excellent antioxidant. So that's really important because we have so much oxidative stress potentially in our bodies due to many, many different reasons. But surgery is one of those. So surgery in itself can cause quite a lot of oxidative stress through surgical trauma, temporary stop of blood flow, reperfusion injury maybe. So anywhere where there is reduced blood flow to anything can cause oxidative stress. And I actually found a couple of really, really interesting studies in veterinary medicine on dogs that looked at the use of melatonin from this oxidative stress or reducing oxidative stress point of view. So there's one paper that looked at it in space surgery, so ovarian hysterectomy in female dogs. There was another study that looked at the use of melatonin post-operatively for cataract surgery. So that's where basically if we have cataracts within the lens of the eye, there's a process called phacoemulsification, whereby that cataract is removed from the lens. And there is quite a lot of potential for post-operative inflammation and complications after cataract surgery in dogs. And so melatonin was used to actually look at post-operative inflammation and to see whether that improved the situation. So that was the second really interesting area. And then the third interesting area that I found was the use of melatonin for oxidative stress after dental surgery. So both tooth removal surgery, but also dental implant surgery. So again, both of those, due to the surgical nature of them, can cause quite a lot of oxidative stress. And so they looked at whether melatonin could improve that in those two scenarios. And in all of these studies, both the space surgery, the cataract surgery, and the dental surgeries, they did find some benefit of melatonin. So that was really interesting, I thought. But that was definitely, rather than sort of its sleep-wake cycle or potential anxiolytic effects, that was sort of truly due to stress from free radicals, and so its role as an antioxidant. And then there were a couple of other areas that I found that really looked at melatonin use sort of from a clinical point of view. And we're going to get to the behavioral topics in a second, or the topics that are important for us in behavior medicine. But one of the other ones, and I am by no means a dermatologist, one of the other ones that was really interesting was using melatonin to treat this seasonal recurrent alopecia, and also another condition known as alopecia X. And so seasonal recurrent alopecia occurs seasonally, mainly in the autumn and winter, where we get hair loss over the flanks. We can kind of get this hyperpigmentation where the skin goes really dark, and perhaps dry skin. And so then initially I thought, well, maybe it's also got to do with this antioxidative effect that melatonin has. But inflammation isn't actually often seen in this type of alopecia. So, and it actually said in the studies that, or in the papers that I read about it, that they're not really entirely sure why melatonin should have a good effect here. But certainly the use of melatonin in some cases caused hair regrowth and, caused an improvement in the clinical signs. And so there was a lot of speculation around whether there was a benefit from an endocrine point of view, from a hormonal point of view, around skin health. But again, I don't think that we're entirely sure why melatonin should have a positive effect here. So that was the other area that I found. And then the two next big areas are as an anxiolytic, so reduction of anxiety, specifically mentioned in some papers, noise fears or noise sensitivities. But delving deeper into the literature here, I really couldn't find anything that showed any kind of sort of deeper reasoning behind this. So there were a number of papers that said, melatonin is an anxiolytic agent, is a calming agent, can provide sedation or calming effects. And again, when you think about its molecular structure and how closely related it is, perhaps to the monoamines, yeah, you could see how that might be the case. However, I just don't think that there was enough evidence that I could find that really made me truly believe that melatonin is an anxiolytic agent. And again, from an experience and an anecdotal point of view, I've never heard any of my colleagues that have been doing behavior medicine for decades, I have never heard anyone really sing the praises of melatonin as an anxiolytic agent. So I think there's caution to be had here. And then finally, we have melatonin as a treatment for cognitive dysfunction syndrome, specifically that sleep-wake component of cognitive dysfunction syndrome. So if we think back to what are some of the sort of classical signs of cognitive dysfunction, we have our DISHA acronym, and I've done quite a few episodes looking at cognitive dysfunction and gone through DISHA in detail. So if you want more information on that, please go back to some of those earlier episodes on cognitive dysfunction syndrome in dogs and cats. And so DISH, and the S is that sleep-wake cycle piece. So D is disorientation, and so on, and S is that sleep-wake cycle component. So we'll often find dogs and cats whose sleep-wake cycle or previously normal sleep-wake cycle is disrupted. So we'll often get nighttime waking, for example, or we'll get perhaps more sleep throughout the day, and just that sort of change in that sleep-wake cycle. And potentially thinking back to, melatonin being that sort of signal for darkness, or that signal for, hey, now it's time to sleep body, that potentially could make sense. And then the other thing I thought about as I was thinking about cognitive dysfunction syndrome and melatonin was not just that sleep-wake cycle piece, but what about the antioxidative properties that melatonin has? We know that one of the contributing factors to that the neurodegeneration that is cognitive dysfunction syndrome is also this excess free radical production and this oxidative stress in the brain, sometimes from reduction of the microcirculation to the brain or other sort of effects. And I wondered whether that might then also be a positive use of melatonin in that scenario. So I think for sure we can definitely think about melatonin from that perspective. And I do know that a lot of colleagues and myself have used melatonin in that scenario. I've actually used it quite successfully in a cat, in a feline case where we had really significant nighttime waking. And actually one other canine case that wasn't cognitive dysfunction, but where we had excessive nighttime waking and nighttime sort of disturbances and disruption. How great did it work in that case? I'm not entirely sure. I think there were a lot of other things that we did, and I'm not sure how big of a difference melatonin made. And we'll talk about that a little bit more in a second in relation to the question I got regarding the shelter. Would it make a difference there? But certainly cognitive dysfunction, antioxidant, sleep-wake cycle, yes, potentially, I think that makes sense. So before I move on to answering this question around, do we think this would be a good medication to use in a shelter setting or in general in nighttime disturbance, I'm just going to go back to this chill protocol and the use of melatonin post, perioperatively. So there are some studies in the human field looking at reduction of preoperative stress using melatonin. And there were a few other studies in the human field sort of around a similar thing. And then those studies in veterinary medicine, so in dogs, looking at the use of melatonin to reduce the amount of induction agent needed for general anesthesia. And they specifically looked at propofol, and there was another study looking at midazolam. And that showed definitely some positive effect on the reduction of induction agent. But let's look at the chill protocol that came out, as I mentioned, in 2023 in JAVMA, and that was, the study was by Costa et al. So the chill protocol comprises 3 different agents: gabapentin, acepromazine, and melatonin. Now, gabapentin is given orally once the night before the procedure. So let's say we've got a dog that's going into the veterinary clinic the following morning for an elective procedure. It could be just an examination. It could be a procedure, maybe surgical, maybe a minor procedure. So gabapentin is given the night before the procedure, so roughly about 12 hours before going into the hospital. And then again, the morning of the procedure, so about 90 to 120 minutes before going into the clinic, which is quite a common way of using gabapentin. The dose is 25 milligrams per kilogram per os, night before, morning of. Then we have the use of acepromazine as a liquid. So not acepromazine tablets, but actually the liquid injectable acepromazine that's given orally, so under the tongue or transmucosally into the mucosa, also the morning of the procedure. So that would be, again, around an hour to 2 hours before the procedure. And then we have, in addition to that, melatonin also given on the morning of the procedure, between 3 and 5 milligrams per dog. So the dogs that are under 10 or that were under 10 kilograms were given 3 milligrams, and the dogs that were over 10 kilograms were given 5 milligrams. We have an average milligram per kilogram dose for melatonin, which is around 0.1 milligrams per kilogram. So slightly different to that. So 3 mgs per dog, dogs under 10 kilos, 5 mgs per dog, dogs over 10 kilos. And that is the chill protocol. Now, they did find, a good effect. They found that there was reduction in stress, in particular, for the dogs coming in for the procedure on that morning. However, we don't know how much of that is attributed to gabapentin, how much of that is attributed to the orotransmucosal acepromazine, and how big of a part melatonin itself has to play in that. We know, for example, that acepromazine, although it's not a great anxiolytic, it is a sedative and it inhibits dopaminergic activity, so it stops motor action. So did they see the dog being a lot calmer from a motor activity point of view? And then obviously we know gabapentin does have anxiolytic properties at that dose range, 25 milligrams per kilogram, yes. And how much effect did that have? So melatonin was never looked at on its own. It was just looked at as a component of this chilled protocol. So I just want to kind of touch on that a little bit, because I think a lot of people refer back to this chilled protocol. And for me, you know, I also find quite interesting is the very sort of the non-specificity, I guess, of the dosing regime, right? That sort of all dogs under 10 kilos, whether you're 3 kilos or you're 9.9 kilos, get given 3 milligrams. And then all dogs over 10 kilos, whether you're 11 kilos or you're potentially 45 kilos, get given 5 milligrams. So that to me is also an area where I'm a little bit like, I wonder, you know, how effective the melatonin is then, you know, on a 45 kilo dog that gets 5 milligrams, you know, opposed to an 11 kilo dog that gets the same dose. So just something to bear in mind here, I think. And so finally, I want to just then answer this question of, do we think that melatonin would be a useful agent for shelter dogs to help them settle? And I think the first question that we need to ask ourselves is, what is it that's causing the dogs to not settle at night? How much of it is environmental? How much of it is noises? How much of it is other emotional states such as fear and anxiety? And we've just kind of already said that it might not be a great anxiolytic from what we know from the literature. Or is there maybe something else going on, such as pain or discomfort? So in my clinical caseload, I have found that probably the biggest contributor to nighttime waking, nighttime restlessness in both dogs and cats has been pain. And oftentimes, and often musculoskeletal pain. And oftentimes when we have actually treated the musculoskeletal pain or the pain, we've had a lot better success at the animal being able to settle at night. So that's a massive factor for me, is what else is going on? You know, do we have, and then maybe in a shelter situation, you know, do we not have a comfortable place to rest? And if you listen back to Carrie's podcast episode with me on sleep, we know how important that sort of safe place and where in the environment the resting area is, in terms of, you know, being interrupted, being stimulated, other noises causing awakening or, you know, arousal. And how much do we think that melatonin can play a part to help reduce this? So melatonin may still do its thing and signal it's now time to sleep and it's time to rest. But when you have a high environmental load, when you maybe have pain and or discomfort, when you maybe have other emotional state, fear, frustration at being confined, anxiety, you know, high stress, and when you maybe have environmental conditions that cause you to wake up, you know, often, intermittently, sporadically, that interrupt sleep. And we know, you know, sleep cycles in our dogs are cyclical. And when they're in that deep sleep phase, if they're roused from that, you know, how easy is it for them to then fall back asleep again? So I think all of those questions are important. And I'm not entirely sure, given what we know about melatonin, I'm not entirely sure whether melatonin would have a sufficient enough effect to combat emotional state, physical health, and that massive environmental piece that I think is a really big piece in shelters. I'm not saying that it's completely ineffective. We don't know enough about it. On the other hand, I don't think melatonin has a lot of side effects. It's potentially not the most expensive of agents. So one could argue, how much harm would it do? You know, could one trial it? Absolutely. But then I would love to see a study conducted in a shelter setting using melatonin at night for the dogs to see whether there was improvement in sleep and in settled behavior overnight. I think that would be a really wonderful thing to look at. That would be the answer to that question, is I think we have to, as always, consider everything, consider what is the main cause. And then, as part of our multimodal treatment plan, always we need to consider all of the things, including that physical health component, the emotional state. And I think frustration must be a big one also in a kennel setting. Fear, anxiety, definitely. Stress, pain, panic, grief, all of those things. Physical health, we need to look at all of those things. So that would be the answer to that question. So that's been a bit of a deep dive into melatonin. And like I say, I am still probably left with more questions than answers. If there are any dermatologists listening to this, I would love, love, love to hear your perspective on the use of melatonin for this seasonal alopecia and also alopecia X. Is that something that you have found to be effective? Do we know what the purported underlying mechanism of action is? Why, if it does work, why would it work? So if there are any dermatologists listening or anybody that's had experience with that, I'd love to hear. I'd love to hear in general if anybody's had good effects with melatonin, even in, that kind of sleep-wake cycle piece for elderly patients, dogs and cats. But yeah, that would be my deep dive. And I'd love to hear if anybody feels that they've had experience with melatonin where they've thought that it's had anxiolytic effects, because I haven't used it in a lot of cases, I'll be completely honest. So my N equals 2, and that's not enough to give even an opinion on clinical experience. So if anybody has had good outcomes or feels that they've had good outcomes, please let us know. Alrighty. That was my deep dive into melatonin. I hope you found this episode useful, and I look forward to seeing you next week for episode 118. Bye for now.